Vagina size myths that are actually hurting you, and what you should know instead. Have you ever stopped to wonder, is my vagina normal? Is it too loose? Too tight? Too big? Too small? If you've ever had those thoughts, you're definitely not alone. But here's the truth. Most of what society tells us about vaginas is based on myths, shame, and a serious lack of proper education. These false beliefs don't just confuse women, they hurt women. They lead to insecurity, shame, unnecessary surgeries, and even missed medical diagnoses. That's why in today's video, we're breaking down the 20 most damaging myths about vaginal size, shape, and function. We're going to separate the facts from the fiction. And by the end of this video, you'll walk away knowing that your body is more powerful, more normal, and more resilient than you've ever been told. 1. Bigger is better or worse. This one comes straight from insecurity culture. Some people are told a bigger vagina is unattractive or loose, while others fetishize it as being more pleasurable for penetration. But here's the science. Vaginas naturally vary in length and width. There is no gold standard. Comfort and pleasure are far more influenced by communication, lubrication, arousal, and emotional connection than by size. Thinking otherwise reduces a complex human experience to bad porn logic. 2. Sex permanently changes your size. Many people believe that if you have frequent sex, your vagina gets stretched and stays that way forever. That's completely false. The vagina is a muscular, elastic organ, built to expand, like during childbirth, and return to its original shape. Unless there are underlying pelvic floor issues or trauma, sex does not wear out the vagina. Let's stop using fear of looseness as a way to shame women for being sexually active. 3. Tampons can get lost inside you. A common fear, especially for people new to periods, is that a tampon might disappear somewhere into the body. But don't worry, that can't happen. The vaginal canal ends at the cervix, which acts as a closed door to your uterus. No tampon, toy, or anything else can get lost past that point. What can happen is a tampon getting lodged high or sideways, which might make removal a bit tricky, but it's never lost. You can either relax and retrieve it yourself or visit a healthcare provider if needed. You have full ownership of your body, and knowledge gives you confidence. 4. Tightness reflects morality or loyalty. This one is as offensive as it is incorrect. The myth that a tight vagina means someone is morally pure or less sexually active has deep roots in patriarchal thinking. Vaginal tightness is not a moral barometer. It is influenced by things like hydration, muscle tension, stress, arousal, and hormones. Some people naturally have tighter pelvic muscles, while others are more relaxed. It's anatomical, not ethical. Equating tightness with virtue is just another way society tries to police bodies, especially women's. It's time we moved past that and focused on healthy intimacy, mutual pleasure, and informed choice instead. 5. Surgery or products can fix you. The beauty industry is now coming for your vagina, and it's terrifying. From vaginal tightening creams to rejuvenation lasers and herbal steaming, women are being sold the idea that their natural anatomy is defective. The truth, unless you're facing a medical condition like pelvic organ prolapse, you don't need any of these treatments. Many of these products aren't approved by health authorities, and some can cause scarring, burns, or infections. These solutions are marketed by creating fear and shame, and then offering a high-cost product to relieve that fear. That's exploitation, not empowerment. Real empowerment is learning that your vagina is not broken. It doesn't need fixing. It needs respect, awareness, and proper care. 6. Masturbation will loosen your vagina. This myth exists because people fundamentally misunderstand how the vagina works. Using toys or fingers doesn't stretch it out or make it permanently loose. Masturbation is actually healthy. It can help you understand your body better, improve blood flow, reduce stress, and even enhance sleep. Your vaginal walls are lined with muscular tissue that stretches and contracts. It's built to handle penetration. Just like exercise builds strength, regular stimulation can enhance your sexual response, not harm it. So go ahead. There's no shame in self-love, and there's no such thing as wearing yourself out. 7. All vaginas should look the same. Many people grow up never seeing what a real vulva looks like. What we do see, in porn, magazines, or edited ads, is a curated, photoshopped version that doesn't reflect reality. Some people have longer inner labia, others have asymmetrical folds, and some vulvas are darker or lighter in pigmentation. That's completely normal. The pressure to get designer vaginas is often rooted in shame, not health. Real bodies have texture, variation, and individuality, and yours is no exception. 8. Vaginas need to be washed internally. The vagina is self-cleaning. It maintains its pH balance and healthy bacteria to protect against infection. Douching or using perfumed products inside the vagina disrupts this natural balance, making you more vulnerable to yeast infections, bacterial vaginosis, and irritation. Clean the external vulva gently with warm water and mild soap if needed. That's it. No floral-scented sprays, no glittery scrubs. Just simple hygiene. When in doubt, remember this. If it burns or foams, it doesn't belong inside you. 9. Pain. During sex is normal. Painful sex is common, but it's not normal. If sex hurts, that's a red flag, not something to suffer through. Pain can be caused by many things: lack of arousal, vaginismus, endometriosis, dryness, or trauma. The good news? All of these can be addressed with medical help, therapy, or lifestyle changes. Don't ignore pain. Don't accept discomfort as your default. Talk to a provider. You deserve pleasure, not pain. 10. You lose all sensation with age. Yes, hormonal changes can affect vaginal tissue and lubrication, especially during menopause. But that doesn't mean all sensation disappears. With the right care, including lubricants, Kegels, hormonal support, and communication, many people find that their sex life actually improves with age. Sensation isn't just physical, it's also emotional and psychological. With confidence and connection, intimacy can stay vibrant for life. 11. You can tell if someone has had sex by looking at them. This myth is pure fiction. No one can look at a vagina and know if someone's sexually active. The hymen doesn't break, it naturally stretches, and in many cases has already opened before sex due to exercise or even tampon use. Virginity is a social construct, not a medical diagnosis. It's time to let go of outdated, harmful ideas that shame people for their choices. 12. A loose vagina means too many partners. Just like body shape doesn't indicate health, vaginal tone doesn't indicate partner count. The biggest factors in vaginal tone are childbirth, aging, and muscle strength, not the number of people you've slept with. This myth is often used to shame women and police their sexuality. But it's baseless, sexist, and medically inaccurate. If anything, practicing safe, consensual sex and taking care of your body, no matter your partner's history, is the mark of maturity. 13. You shouldn't talk about vaginal health. Many of us grew up being told not to talk about down there. As a result, we enter adulthood confused, anxious, and sometimes suffering in silence. Talking about vaginal health openly, with friends, with doctors, even in videos like this, helps normalize bodies and reduce shame. You have a right to understand your health, ask questions, and seek help without embarrassment. Silence breeds shame. Education creates empowerment. 14. You don't need a gynecologist unless you're in pain. Preventive care saves lives. Annual checkups, Pap smears, and HPV screenings can catch problems early, long before they become serious. Even if you feel perfectly fine, seeing a gynecologist regularly is an important part of self-care. You get a chance to ask questions, get educated, and make informed decisions. Don't wait for pain. Make your reproductive health a priority, always. 15. Men can feel the difference in tightness. Many men believe they can tell how tight a vagina is and judge someone's sexual history from it. In reality, tightness is influenced by arousal, comfort, lubrication, and stress. It's not a fixed measurement, and it doesn't say anything about a woman's past. Pleasure during sex is a shared experience, not a test of someone's anatomy. Let's retire this outdated, ego-driven myth for good. 16. Giving birth permanently loosens your vagina. This myth has been used for generations to shame women after childbirth, and it's both misleading and cruel. Yes, vaginal childbirth does stretch the vaginal canal, and it's completely natural for the muscles and tissues to expand to accommodate a baby. But here's the truth. Your vagina doesn't stay permanently loose. After delivery, your body goes through an incredible recovery process. The vaginal muscles gradually contract and rebuild tone over time. For some people, it may take weeks or months. For others, especially after multiple births, the recovery might take longer. But there are effective, evidence-based ways to regain strength, like pelvic floor exercises, Kegels, physical therapy, or, in some cases, medical treatments. What's important to understand is that giving birth doesn't ruin your body. Your vagina isn't damaged. It just needs support, healing, and time. Society puts unfair pressure on women to bounce back, often equating tightness with sexual value. But real intimacy isn't about muscle grip. It's about connection, comfort, and care. So let's stop shaming women for giving birth and start celebrating what their bodies are capable of. 17. Using dildos will make you numb or too loose. This myth comes up all the time, especially in online forums and misinformed conversations. People say that using dildos or vibrators too often will make you numb, or that your vagina will get used to them and stop enjoying real sex. Let's set the record straight. Your body doesn't get ruined by pleasure. Vibrators or dildos are simply tools. Like gym equipment for your muscles, they help you explore, strengthen, and understand your body. What can happen is temporary desensitization if you always use high-intensity vibration without variation. But that's easily managed by mixing up stimulation types, using gentler settings, or taking short breaks. It's not permanent, and it doesn't mean you're broken. As for getting too loose, again, the vagina is a muscular, flexible structure. It stretches during use, but it contracts right after. It's literally made for that. The bottom line? Toy use doesn't damage you. It empowers you. Shame, not toys, is the real enemy of healthy pleasure. 18. Vaginal orgasms are the real orgasms. For decades, people have been told that vaginal orgasms are the ultimate proof of sexual satisfaction, and that clitoral orgasms are somehow lesser or immature. This idea is not only outdated, it's biologically inaccurate. The truth is, the clitoris is the primary organ of pleasure for most people with vulvas. It's made up of over 8,000 nerve endings, more than the penis, and is responsible for the majority of orgasms. Vaginal penetration alone doesn't stimulate the clitoris directly for most people. which is why many don't orgasm from intercourse without added clitoral touch. Unfortunately, this myth creates shame, pressure, and false expectations in relationships. Some even feel broken for not climaxing during sex. But there is nothing wrong with you. Every body is different. What matters most is exploring what brings you pleasure, communicating with your partner, and letting go of false performance standards. There is no hierarchy of orgasms, only what feels good and right for you. 19. You only need to pee before sex, not after. Many people are taught to pee before sex to avoid discomfort, but peeing after sex is actually more important, especially when it comes to preventing infections. Here's why. During sex, bacteria can be introduced into the urethra, the tiny tube that carries urine out of your body. If you don't urinate afterward, those bacteria can travel up the urinary tract and lead to a urinary tract infection, UTI. Peeing before sex may help if your bladder is full and you want to avoid pressure, but peeing after sex helps flush out bacteria and protect your body from infection. This is especially important for people with vaginas, since their urethras are shorter, meaning bacteria have a shorter path to travel to cause infection. So, the takeaway? If you can, try to pee within 30 minutes after sex. It's a simple habit that supports your sexual and urinary health. No shame, no awkwardness, just self-care. 20. Certain sex positions will permanently change your vagina. There's a widespread and totally false idea that specific sex positions, like deep penetration or rear entry, can stretch or damage your vagina over time. Some even claim certain positions will make your vagina permanently wider or looser. In reality, your vagina is a muscular and highly elastic structure that adapts temporarily during sex and then returns to its natural state. No position, no matter how intense, will reshape or ruin it. Different sex positions may feel different, and some may lead to deeper sensations, especially near the cervix. But none of them cause long-term changes in size, looseness, or shape. Believing this myth often leads to fear, shame, or even avoidance of sexual exploration, especially for women worried about being judged afterward. But sex is meant to be mutually enjoyable, comfortable, and pressure-free. If something feels uncomfortable, that's worth discussing or adjusting. But it has nothing to do with ruining your vagina. Your body is strong, adaptable, and resilient. Most women were never taught the truth about their bodies. They grew up surrounded by silence, shame, and misinformation. And those myths became silent rules that shaped how they saw themselves. But here's what those myths never told you. Your vagina is not a problem to fix. It doesn't need to be tighter, smaller, cleaner, or more normal. It already is. The way it looks, feels, reacts, or changes, none of that makes it wrong. Those differences are not flaws. They are biology, uniqueness, and strength. Whether you've had sex or not, given birth or not, used toys or not, you deserve real knowledge, confidence, and pleasure without shame. The goal isn't to meet some unrealistic standard. It's to be informed. Because once you understand how your body works, no myth can control your mind. Talk about this. Normalize it. Unlearn the lies. Share the truth with others who never got the chance to hear it. You are not broken. You are not too much. You are not enough. You are powerful. You are whole. You are already everything you need to be. What's one myth about vaginas you grew up believing and later found out wasn't true? Drop it in the comments. Your story might help someone else unlearn the same lie. Don't forget to subscribe and turn on the notification bell for more bold, honest, and empowering content like this. Thanks for watching. Thanks.